Hello. With me, I have Dr. Amresh Srivastava. I have a few questions for Doctor. Sir, the app which you've built, is it available only in English or in regional languages also?
Well, the app was constructed in English language. There is a system to translate psychological tests from one language to another, which is a very complex research based. You translate it, do the research, then back translate it, do the research, and you match that they are exactly the same. Well, this kind of research is going on, but at this moment, what we have done, we have literally translated only the questions, and the English language question also remains there, so that one can read both and make sense out of it. Because most of the students, though they may be in English language, though they may be in English medium and may be bright in English, but their understanding into their language in which they have spent their childhood is much better. So far, it has been translated in Hindi. Our Marathi draft is ready, and very soon we have in Marathi as well. And at the end of 2 years, I believe it will be in 7-8 languages available.
I totally agree with you, sir, because people are usually more comfortable in their very
Yes,
own
true,
native language.
true.
I would like to share something with you, sir. After my national seminar, I had the opportunity to sit in seminars about mental health and well-being.
Right.
And that's when I realized that not everybody does have a proper mental illness, but sometimes we just feel sick because of the situations. Do you suggest that even if I feel sick not having a mental illness, should I give the test or should I not? Just leave it?
Well, this is $1,000,000 question. Some students have mental disorder. Let's keep that aside. But some of them have mental health conditions which is just at the boundary. It does not qualify, so nobody can say a diagnosis that you have definitely have depression. But they have very high level of risk that they may develop. I mean, let me explain that somebody does not have a heart attack but has high cholesterol, diabetes, blood pressure. So we don't diagnose that you have heart attack, but we say, well, chances of developing a heart disease is higher. Similarly, there are students who do not qualify for a psychiatric diagnosis, but they have number of factors which indicates that they have sub-threshold symptoms which are lesser than a diagnosis. But what is important is that even those symptoms are very disruptive, very disabling, very painful. It decreases their symptom, decreases their function, it robs them of their happiness. So it is important, and one of the purpose of the app is not only to find out who is suffering from what. The app does not diagnose, it does not prescribe, it does not take the realm of a qualified psychiatrist. No, it's a combination of technology and human behavior, human resource. So what it does, it taps the risk and the chances, the adversities, the function. You see, level of functioning is very sensitive marker. For example, if it's say the case of diabetes, few years back we did not have HB1AC to tell us how you have the diabetes. Say 20 years back it was not there. So translate science into people's program is a difficult task. Similarly, today we hear that level of functioning, how a student is functioning, is a real marker of mental health. So if there are 100 students and you can find out that 20 are not functioning, they want to study but they cannot study due to whatever be the reason, those 20 will need more mental health support. So this is the beauty of our multi-dimensional test. There are 6 tests which can tell you what is the level of functioning, what is your resilience, which can tell you how well you will cope. Then there are tests for whether do you have a symptom, whether you have a risk factor, and then what is your level of stress and what is the source. Do you want help for that or you don't want? Are there concerns? So it gives you a picture of totality. Now when you read the report, it is very clear what should you do. Even if the recommendations are not there and you find that I have severe stress and my level of functioning is low, all intelligent students will get the question, what should I do? Whether you ask your parent, you ask your teacher, or you ask your doctor. There are three beautiful resources in our country and they are always ready to respond. You can, those who don't want to talk about it, they can very easily walk into the clinic of a family doctor and explain that I am suffering from loneliness, I am suffering from hopelessness. These are important symptoms which our students suffer from. Say low self-esteem, inability to cope. The fundamental problem is inability to cope. There may be stress, but the question is who is mentally robust enough, who has mental strength to cope and who cannot cope. Those who cannot cope, we should find out who are they and develop and design a program that's best done in the universities and colleges. How and what program is to be implemented depends on the culture, the place, the village, the city, the metro city, what resources are available. But everywhere the programs can be developed. You can develop football match, you can develop cricket match, you can have prayers, you can have relaxation, you can have communication, you can have teachers spending more time with such students. You can warn parents that please look after, do something. Do something is what we want to find out and tell people, make them aware, make them alert that your child is different, you must pay more attention.
Sir, I would like to clarify one thing. Does your report or your app try to replace the psychiatrist, or is it just a way or a method for students to understand about themselves?
Well, there is no question of replacing any professional, whether it is a psychiatrist or cardiologist or anybody. I don't believe any app should do that. What technology of an app should do is to facilitate the process. As I said, 80% people do not have access to care. So here stigma is so high that even if you have a psychiatrist in every society, the chances are that nobody will go because of judgmental problem. So the question is, how can we override stigma? How can we block stigma? How can we remove barriers for students to go and frankly say, like you go in a mall and say, I am having a fever, I want to go to a doctor. You go to doctor, he gives you treatment and you are fine. So it's easy for you to go. Similarly, it should be for the mental health, but unfortunately that's not the case. So we have to build a case where we facilitate. Technology has given us chance to take it far and wide, every corner of our country. Everybody has a mobile phone today. I mean, very high number they have mobile phone. We tried to build upon the test that can be digitalized, can be taken far and wide to facilitate. How can we facilitate? We want students to self-assess, not self-diagnose. Self-assess that they have inkling of having problem, confirm that yes guys, you have problem, you must go right and meet your counselor. So the app is not competing with any health profession. In fact, app cannot, because early intervention or treatment is an art which qualified people know and nobody else knows.